So today I'm going to talk about hand reflexology and dentistry after my own recent experience. Now, for those of you who know me, you might notice I've got a bit of a swelling here in my face where I had a dental implant a couple of days ago. Obviously the swelling will go down and it'll all be fine, but while I was waiting in the dentist, I was doing what many of us do, fiddling with your hands, maybe thinking about some deep breathing, working the solar plexus, diaphragm reflex, all the usual sort of tricks that we do. And I would normally expect to work the toes and the jaw across the front, reflex across the front of the toes, with the jaw being on the little toe. So if this is zone 5 here, the little finger, zone 5 would come up and then up the side of my face and then obviously work across the face. So here in the jaw, I thought, well, I'll just work that. And I worked my finger really hard. I couldn't feel any pain or discomfort across here because I'd had a tooth removed a while ago, so there was nothing going on there, no pain or anything, but I was having a dental implant here. So feeling across my fingers to see if I could feel anything at all before, and I couldn't. So then you go into the dentist, and for this procedure they gown you up, put a hat on and everything. So got my hands under my gown there. I'm just going to carry on feeling the dental reflexes on my hand, which I would work across the tops of the fingers. And lo and behold, here in my little finger, during the procedure, I could feel a sharp pain. I can still feel discomfort there now, but that pain wasn't there beforehand. So for me, that reinforces that this is where I'd be looking at feeling and finding the dental reflexes. So something you may like to do for yourselves or for your clients, for anybody who's going for any dental procedure, find the sore spot, the corresponding area on your fingers. Nobody's going to know what you're doing. People will think you're just fidgeting if it's for clients, but obviously if it's a reflexologist, you can do what you like. But I will certainly be recommending to my clients and showing them how to find a dental spot on the hands that they can work for self-help during any dental procedures. So for those of you who know me, you know I like a bit of evidence. Yes, people can tell you all sorts of things, but I like to feel it and see it for myself. I was actually planning in my mind how I was going to use RLD to help reduce the swelling in my face. Who knows if I have, but I've certainly tried, and it was worse on Friday when I had it done. So I've been doing my own hand reflexes since then. But hand reflexology is something that I would say I largely ignored or didn't pay much attention to prior to the pandemic, but it is something that I've now explored for self-treatment, for working remotely with your clients, and also I teach the RLD hand sequence as part of the online training now. Anyway, thank you everyone. I hope that's helpful. Actually, mostly I hope you don't have to have any dental procedures, but I can still feel that on my finger now, and I know that it wasn't there before the dentist started. And now it is, although it is getting a little bit easier. It was amazing. When he started drilling into my face, I felt this sharp pain in my finger. Obviously, your face is all numb. Anyway, thanks for listening. Bye for now.